Well, good afternoon. How are y'all? We're just about ready to get started. We're just tweaking a couple of things. For those of you that are regular attendees, you can see we're in a different layout. So we wanted to make sure and get everything set up for you because part of the way we're going to be listening to our presenters, and then we're also going to have an opportunity to stand up and move a little bit. So the table setup was not going to be good for us. And when we came in here, they double booked us over here. There's a church that's been holding a Bible study all week. So when we came in here, we talked about, well, should we sit this way at tables? Because here's where our presentation is, so you are going to have to turn. But we've got great presenters here. So this is really just a reminder for me, your moderator, and for them as to what slide are we on. Debbie's given you a lot of information to keep up with, and if there's anything afterwards, for all, especially those of you that are new, if there's something that comes up that you feel like it would be great if we had a copy of that, or I'd like to have some of that information. We all the time have requests. Can you send me an email with that slide or with that information? So Debbie's great at doing that. And Debbie Ford, which is our operations manager, we'll talk more about her in a minute. Debbie is the person that you sign up with and calls you and says, are you still coming? So we're going to accommodate you as best we can. All right. So other than that, I think we're going to go ahead and get started with our event today and get moving. Okay. Other things that I want to share with you, just kind of getting us going, is to have you meet our team. I'm Ingrid Sullivan. I am a real estate agent. I'm a right-sizing expert. And my specialty as a real estate agent is I focus on 55 and older. I work with all kinds of clients, but 55 and older is my favorite, and that's the area that we work on. My partner in life and my partner in business, John, if you'll raise your hand, John Sullivan. John is also a real estate agent and a right-sizing expert. And then we have another John that's a part of our team, and he's he lives in Princeton. He just joined our team this year, and he is working with clients 635 and north. And then Debbie Ford, which you've all seen her at the table when you signed in and coming up here and getting everything going. Debbie's our operations manager. Debbie helps put everything together. She creates the PowerPoint presentation that we work off of, so she's a very, very important part of our team. But that's our team. In addition to that, just briefly, this is our business model. And I haven't looked at today's handout, so I don't know if it's in your handout or not. But just so that you know just a little bit about us, we're real estate agents that started with our own parents. There was a time when my mother-in-law needed to make a move. We had visited a lot of retirement communities and smaller homes, etc. And she moved to a community here in Arlington called Town Village on Park Road, and Pioneer Parkway. And what happened with that is well, there is one on Park Road, but not that one. We found out during that time that our business is more than just selling houses. Our business requires us to be able to help people when they need to make a repair. I've got 2 houses right now in Arlington where there's some nail pops in the ceiling. There's some scratches on the wall. So we have people that can help with that. That's our handyman contractors. We also have estate liquidators. Typically, when we've lived in our homes 30, 40, 50 years, we are not going to take all that with us when we right size. We have legal and financial individuals that work with us to help with those things like power of attorney, trust, how does my money work with what I plan to do? And then we also have retirement communities that we work really closely with for those people that are planning on making a move and they want to move to an active 55, or they want to move to a full-blown senior living, if you will, that has independent living, assisted, and memory. We have them here as well, and they're going to introduce themselves in just a moment. But this pretty much sets us up. So we started as real estate agents. We built our move management company, which is senior downsizing experts, and that's comprised of all of us working together. And then the other fun side of our business is that we have seminars, and several of you have been attending. So this is our 7th series of the Smart Senior Series, and we are already in planning stages for next year. That's who we are. So let's talk about our seminar today. Let's take a quick survey. Thinking of yourselves, who here has fallen before or knows someone who has? Oh, yeah. I mean, we all have. We all know, or we've known somebody that has, and that's really important. Does anyone feel like they're currently at risk for a fall? I mean, there's so many different things. You could be walking up your sidewalk, and if the concrete has changed, you could trip there and you could make a fall. You could be walking on the lawn that you just watered and not realizing the grass is still really wet and slip and fall there. So there's a lot of places for us to fall, for sure. Do you think falling is inevitable or a normal part of your aging? No. You don't think it's a part of your aging? Do you think it's inevitable that you're going to fall? And does it come when you get older? Yes. I think my feeling would be it's really more inevitable. Things happen, vision, other things that we're going to talk about today. So let's look at some statistics that we have here regarding that topic. So 1 out of every 4 adults age 65 or over falls each year. And again, just like what we said earlier, it could have been us or we know somebody that's happened to. 20 to 30% of these falls lead to moderate or serious injuries, knees, hips, arms, shoulders, those kinds of things that kind of get us out of our groove when that happens. 95% of hip fractures among older adults are caused by falls. I would say yes to that. That's for sure. And then falls are the leading cause, unfortunately, of deaths for people that are 65 and older because hitting your head, those kinds of things that go with that. So it's something that's important for us to pay attention to with everything else that we have going on in our lives. What I'd like to do next is I'd like to take a minute and have our presenters, our experts for today, take a minute and introduce themselves. And if you two would stand and tell our audience a little bit about you.
My name is Caitlin. I am a physical therapist and center manager for the past 10 years of a clinic on 360 in Trinity, about 10 minutes up the road. So if I've treated anybody before, please come say hi to me. I would love to meet you guys again. My parents are in the audience, so I love them hearing me being called an expert. I've been telling them that for years.
Yeah, there you go.
So,
there you go.
I specialize in orthopedics and hands-on manual therapy skills, so I treat a variety of diagnoses, but I really believe in my passion is preventing the injury, not so much treating the injury. So that's why I love being here today. I'm so happy that they had me.
All right, my name's Jessica Turner. I'm from Medical City, Arlington. I'm a nurse. I've been a nurse for about almost 15 years now. All ICU, so a lot of these injuries that we're talking about, I've seen in the hospital. I am now what's called an injury prevention coordinator. Ooh. So my job is to go out into the community and do events like these and do education to keep people from coming into the hospital with preventable injuries. Our number one is falls. So I've become quite a fall specialist, if you will. I teach a class every week for fall prevention, which we'll talk about later. And I'm really excited to be here, so thank you for inviting me.
Thank you both for coming. We really appreciate that. Okay, so let's go ahead and get started. And Jessica, I'm going to ask you this first question. If you could go through this with us, what are some of the physical and psychological consequences of falls? And don't forget to speak up for our audience.
Oh, I mean, that could be anything really. Physical consequences of falls. It's not just what you think about with your broken bones, right? Like, that's obviously our number one physical consequence of falls, but you could get into a head bleed, you could have kidney failure, you could have infection. So a fall can really affect every body system that you have.
Okay, great, thank you. Well, Caitlin, let me ask you the next one. Tell us Whoops, wrong direction. Tell us what some of the risk factors are regarding falls, and then I will have Jessica follow you.
Sure. So some of the internal obvious ones, a lot of it is vision and hearing changes. So if you don't see where you're going, that's a problem. If you don't hear, it messes with your inner ear, which is your balance system. That's a big deal. So as you age, you lose some of those things. Vertigo and other inner ear challenges, we talked about that, but are you feeling dizzy? That's a big deal. Are you able to walk a straight line? That's a big deal. Neuropathy. If you can't feel where your feet are, how do you know where you're putting them? So that's also happens with diabetes and things like that. Cognitive impairments, obviously, are you knowing where you are? Decreased strength, that's the biggest one. Unfortunately, as you age, your body type changes. You lose muscle mass and your joints are stiff. So you are setting yourself up for impaired strength, and you don't have the opportunity or the strength to catch yourself if you are falling. And then it leads to further problems of getting back up. So slower reaction times goes along with the catching falls. History of falls. So I love this one because if you've fallen and you come into my clinic, you are automatically considered a fall risk from here on out, because a fear of falling and a history of falling is your #1 risk factor. So if you have fallen in the past, you need to be on something to prevent future falls, whether that's a balance class or exercises at home.
I'll just share real quick, years ago, I had a series of, I have Graves' disease, which is an eye disease. And over a period of a year, I had 20 eye operations to try to correct my eyes, which they're good now. But what I found myself doing a lot of times is walking, but this way, to make sure that I was paying attention to where I was going. But what happens when you're doing that is you're only seeing so far. It's better when you can stand straight up and see everything in front of you, but sometimes that fear of what if I trip on that, or when my dogs are out, when I'm walking my dogs, they're walking me. And so I'm trying to pay attention that I'm not going to go to that uneven part of the sidewalk and maybe trip and fall and have them drag me the rest of the way. So I think that, when you said vision, is what came up for me right away.
Yeah.
Jessica, what do you have to add to that?
Like she said, she brought it up, the history of falls. So if you come to the hospital and you'll get asked if you've ever fallen, if you've fallen in the last 3 months. That officially makes you a high fall risk in the hospital, so you're going to get all of the fall risk prevention. But also that fear of falling is really big, and it's something that with exercise and balance techniques that you kind of learn to overcome, it will never fully go away, because if you've fallen once, you are going to be scared of falling again. But if you have the techniques, then you can kind of help yourself not be so scared of falling.
So we'll be talking about those techniques later?
Yep.
That's good, I like that. That's going to be helpful for all of us. All right, well, let's talk about the physical, oops, I still think I'm going the wrong direction here today. I'm backwards. Fall risk assessment. So tell us what happens when there's a fall risk assessment. And I think what I'm going to do here in my notes is, let me go ahead, Jessica, start with you.
Sure. So fall risk, like I said, the first thing they're going to ask is, have you ever fallen? Have you fallen in the past? Have you had an almost fall? Have you caught yourself? That sort of thing. So that's going to be the first part. Are you afraid of falling? Then comes after that. Those are the things that we look at the most, because like she said, that's going to be your #1 risk factor for falling in the future. Then we're going to talk about your glasses. Do you have glasses? Are you wearing your glasses? Do you wear your glasses when you're supposed to? And then into the hearing, do you have your hearing aids turned on? Do you have your hearing aids turned up? And do you have any balance issues because of your hearing? Do you have any ringing in your ear? Like she said, she's got tinnitus. So if you have this constant ringing in your ear, you may be missing cues of, oh, I'm going to trip over my dog or something, because you're focused on the tinnitus.
I wish you hadn't have said that, because now I'm going to be thinking that.
You need to be aware.
Yes, I know, absolutely. Caitlin, tell us some more about that.
So this is a common assessment that I gave to them for my intake. If you're going through physical therapy, if you answer this and you say yes to 2 or more of these questions, you're automatically considered a fall risk, and it cues your physical therapist to now perform functional screens. So we are going to compare you in different movements, whether that's, we do a 5-time sit to stand test, which is, can you stand up 5 times without your hands in less than 30 seconds. And that, if you cannot, or if you have to use your hands, that sets us up another risk of falls. Another one we do, a functional screen, is a timed up and go test. So can you stand up, take off, walk 10 feet, turn around, sit back down within 13 seconds? Those are normal ranges that you should be able to meet, and if you fall below those automatically set up goals for your treatment for physical therapy.
Okay, that's great to know. Well, the importance of exercise as we age. So, Caitlin, continue to talk to us about that, because I think all of us, we all know that we need to do it. I know that John and I work really hard to do water aerobics, and a lot of people say, oh, that's just a sissy sport. Well, it's not. We do lift weights while we're doing that, but you know, it's important to keep your brain happy, and when you're exercising, you're keeping your brain happy, correct?
Yeah, absolutely.
Take it from there.
All of those great things that she listed on there is perfect. You know all the benefits of exercise, but what I think you don't know is the things if you use it or lose it. So as I tell people as they age, it's super important to do 3 things. You want to work balance, work your core, your middle, and work posture. So those 3 things is as you age, if you don't do those, you're setting yourself for risk of a lot of things other than just falls, but many injuries as well. And if you have the muscles, you're going to recover from injury, recover from falls a lot faster than if you're starting from a negative. Does that make sense? Yeah, so obviously it improves your posture. If you're constantly going forward, your center of mass goes forward, you're more at risk to fall forward or trip. So posture is key. You lower your risk of your heart disease, cancer, diabetes, immune function, all of those great things, blood pressure, all of that comorbidities is what we call it. You will, if you exercise, they go away or diminish. Yep.
Well, I think the other thing too that we have here on our list that's important for us to think about, if you are someone that has experienced falling, like we've been talking about, and it's in the back of your mind and it makes you nervous about your stability, how willing are you to get out and attend things? That may be a reason that you say, oh, I would love to go for that, but you know, I don't think I could really do that. What if this happens? Or I'm not sure that I would be able, my endurance may not be there. So I think being aware of what they're talking about and putting some of those things in place is going to help you better to stay engaged and social with the different organizations that you might belong to, whether it be your church or something, just so that you can feel like you're still, for lack of a better way of saying it, with it. You're still able to do things versus staying at home because you feel like your health is going downhill and you really can't be out because it's too risky. Am I going down the right track? Okay, so let's talk about the benefits of balance exercise. And when we talk about that, Jessica, I know that Debbie's parents have been attending your class and giving you rave reviews about that.
Oh, thank you.
And we have another attendee that normally comes to our seminars that's been attending that. So let's start with you and tell us what the benefits are. And just, if you could just kind of go slow over that and give us the details.
So obviously exercise is going to increase your muscle mass, right? You're moving your body, you're moving your muscles, so therefore you're going to increase your muscle mass. The more you increase that, the better your balance will be. You know, our bodies are built to stay upright, and the more that we use our muscles to stay upright, we will continue to stay upright. It's kind of a simple equation there. But your bones are also a cushion. Our fat is a cushion, so that's kind of, you know, we don't want too much fat, but we want more muscle to cushion our bones. Improves cognitive function. I say this in our class all the time because I will kind of do something that is a little more coordinated for our uncoordinated people. But I say, you know, now we're not only working on our bodies, but working on our brains too. So when I do, you know, different steps with our feet and our hands, it's not just because I wanted to increase our cardiac movement, I want to increase our brain function too. Let's see, improve reaction time. So, I mean, that's, you know, the faster you are, the faster you're going to react to falling. So the better you are at moving your body, the better you are at your reaction time.
I know that John and I attend the Y on South Cooper for our swim class, and it's from 7:15 to 8:15 in the morning. It's every day of the week, but we have certain instructors we like that we go to and others we don't. But one of the things that I think is really beneficial, while you get into your routine, especially when you have the water weights, they're constantly having us do something, switching to the left or switching to the right or circling around, but the next one's going to be circling around the other way. And I think just the cognitive benefits, I'll say for me, once I've gone to a class and I'm ready to start my day, I feel like I'm much more with it just from going through that. And of course for me, just me personally, I hate it when I'm going right and everybody else is going left in the class. So, you know, so I'm paying attention to make sure that when they're telling us you better turn around and go the other way when you're doing your, it's important to pay attention. Okay, well, let's see what else we got here. Is there anything you'd like to add to this slide?
Well, I love the strengthens bones. And nothing against water because I think it's amazing, but you have to put weight-bearing exercises in your routine or else you're setting yourself up for further bone deterioration, whether that's osteopenia, osteoporosis. So water is amazing, but get yourself out there and do some resistance training, whether that's just, I gave you some handouts, but going for a walk is weight bearing. So that'll help strengthen your bones, which will lead to less fractures if you do fall. So stronger bones is a stronger recovery.
Well, I have a question on that, and for myself, I just had my physical not too long ago, and my doctor said, you really need to get more involved with weight-bearing exercises.
Correct, yeah.
And, you know, you think, well, what exactly does that mean? I have some weights at home. How do I know what exercises to do and what areas I'm supposed to work on? Because not everybody has a place that they want to go or feels comfortable to get out and do that. So are we going to be discussing that today?
I can definitely discuss that. I can talk exercises all day.
Okay.
Absolutely.
Okay, all right.
I would say probably if you want the biggest bang for your bucks, do the functional movements in a weighted position. And that could be sit to stand. So what is that? It's a squat, right? So you can hold on and do some squats, all of that. You can do other functional movements, which is the bridge, where you're laying down and lifting your hips up. I'm sure if you've ever been to a physical therapist, they have taught you that exercise. Walking is excellent. Stairs, practicing stairs is loading those joints, loading the knees, loading the hips, obviously using a handrail for safety. But just doing anything where you can see the forces from gravity pushing on those forces, that's what your bones need to install health and get stronger. So hand weights are fine, but like they're not a lot of weights.
Yeah.
So wall push-ups, again, if you want some arm strength, that's resistance weight-bearing exercises.
And how would somebody know how many to do as they get started?
I always say like 3 sets of 10 is a great number. Everyone says that, and that's an easy one to do and to remember. And if you do 3 sets of 10, it's easy to kind of just continue, right? Just remember that number in your head. But the best rule of thumb is if it's hard by the last set, then you're probably working your muscles correctly. So you don't want it to be super easy the whole entire time, or might not be enough resistance. But the first 2 sets should be kind of okay. The last set should be struggling.
Okay, remember that. The last set should be struggling.
But not losing form.
But not losing form or balance.
Correct.
Yes, okay. John, did you hear that? The last set should be struggling.
There you go.
Okay, so exercise guidelines. We did talk to you today that we were going to be doing some movement, and that's coming within our presentation today. But I think it's also important for us to talk about some of the guidelines that we have. We did just speak about some of those. Jessica, do you want to add to this? And well, just let me interrupt you just real quick. Debbie, is this slide in their handout?
It is not, but we can definitely share it.
Yeah, I think this would be a good one for them so they could just kind of look to see what kind of exercise and how much to do.
Yeah, so this slide is just going over some basic, how often you should be doing something. But a big thing on here, flexibility. We've been talking about strength training and balance, but flexibility is also really good. The more flexible you are, that's going to increase your reaction times, it's going to increase your abilities to do all the other things. So flexibility exercises are really good too. So some types of balance, obviously there's Tai Chi, there's dancing, yoga, And really just walking is a really good balance exercise as well. And I'm going to show you some walking exercises that you can do in a little bit. And then strength, obviously that's, weightlifting and some of the things that Caitlin has just said. And then you want to get your heart rate up. So whatever you can do to get your heart rate up, as long as you've talked to your doctor, to get your heart rate up, that's going to be a cardiovascular exercise, and that's what we like to see.
So that could be like stair climbing.
Stair climbing, it could be walking, it could be, anything, cycling, anything that gets your, we're going to do some sitting and standing, that will get your heart rate up. So that's what we want. We want your heart rate up, and we want to kind of sustain it up for a little while. And like I said, speak with your doctor first before you start doing any of this, and go from there.
So I'm just curious, as we've been talking about these things before we get busy with our movement, how many of you are involved in some type of exercise every day that maybe you're going to a senior center or a YMCA or something like that? How many of you? Oh, that's awesome.
Every day, not every day.
Not every day. During the week. Yeah, thank you. Yeah, during the week. Okay, that's good. That's a large amount. How many of you are doing some of those things at home? Okay, that's good too. That's great. Okay, great. Anything you would like to add to this?
I would say that if you're looking at that heart rate max, we had that up there on our presentation. 220 minus your age is the max heart rate that you want to get to. That is probably not appropriate for a lot of people, because if you are on medications that are regulating your heart rate, please do not go by that. So if you're on anything that's a beta blocker or heart regulator, do not go by that max heart rate. Do not try to get your heart rate up high.
Okay, so I kind of got some of that, but could you just slow down and tell me that again?
So the monitoring your heart rate max is the safety is 220 minus age is your formula.
220 minus age.
We use that for adults who are not on any medications regulating your heart rate. So if you are on medications given to you by a doctor or a cardiologist, do not go by that. Do not try to get your heart rate up high.
Okay.
Did you say what, beta blocker?
Yeah.
Beta blockers are one that regulates your heart rate.
So they could do something, but they need to.
Not go by your heart rate.
Yes, do not go by your heart rate. Go by your perceived exertion. That's what we use in the clinic. So on a 0 to 10 scale, you should be exercising in a 7 to 8 range. Is that correct? Okay.
Out of 10.
Out of 10. Let's say 0 is rest, 10 is the hardest work you've ever done. You should be exercising, and you should not be able to carry on a conversation next to you. So that's the talking method too. Are you breathing? Are you able to monitor your heart rate in a sense of it's not getting out of control? Any
Are we all good on that?
That's just a safety mechanism. I saw that up there. I was like,
Yeah.
please don't tell people that and not explain.
I think that's good.
Okay.
I mean, we're here with the experts. We're here to guide, but we don't want to get calls next week that they did what they said and guess where they are now.
Yes.
Yeah. Okay.
We're going to call on my friend Nancy here. I'm not going to make you do it. What's our number one rule?
There's no falling in all class.
Yes.
Number one.
Okay, number
2, there's no judging.
Oh, I like that.
Whatever.
No falling in fall class and no judging.
Judging.
So if you need to use a chair in any of these exercises, please use your chair.
Yes.
We will use it for balance because we are not going to fall.
I'll be in the center.
All right, come on.
She's going to tell us.
Okay.
Okay, is everyone ready? So the first 2 exercises I'm going to show you, we don't really have a lot of room in here to do it, but I want y'all to see some easy walking exercises. Some easy walking exercises, okay? So the first one we do, it's a normal walk. If you can't see me, I'll walk around through you. But you're just going to walk normal with your feet, and you're going to turn your head side to side. Sounds scary, but you're going to walk normal, head side to side. Okay? If you need, yeah. If there's room, yeah. Don't run into each other.
Saying that. Okay.
No falling, remember.
And take it slow if you get dizzy.
If you have vertigo, this probably isn't the exercise for you. Just throw that out there.
Okay.
So if you're a daily walker and you're already doing your walk, just add a head turn into it, and that's going to work on your balance, okay?
Okay.
All right. The second walking one, we like to call the sobriety test. You're going to walk in a straight line in heel toe. So one foot in front of the other, heel to toe. If you have to airplane,
seems harder.
you can airplane. If you have to put your hands on your hips, that's fine. Try not to look at the ground, because if you're looking at the ground, you will end up on the ground.
Yeah, I know.
If you look at the ground, you'll end up on the ground.
Oh, okay. All righty.
It's a little harder, yeah.
Okay. Good job. Good job.
If you have bad hips, take a bigger step.
All right.
All right, good job. So now that those are our two walking ones. So we're gonna do heel toe, but we're just gonna stand in heel toe. So you're gonna find your balance, one foot in front of the other. You wanna make sure your ankles aren't wobbling. You wanna keep your feet flat on the ground. And we're gonna hold it. It's hard. Once we all get there, good. Now we're gonna switch feet. Same thing, find your ankles, feet flat on the ground. Okay, yeah, if you have to airplane, you can airplane. Yeah. So that's really good. We hold this for anywhere from 30 seconds to a minute. So this strengthens your ankles.
Oh.
All right, good job. Okay, our next one. Now normally we have chairs, but it's called a circle walk. And so what you're gonna do is walk in a circle. So you're gonna walk in a circle, you're gonna walk in place. You're picking up your feet, you are not shuffling. If you need to widen your circle to make it a little easier, you can widen your circle.
So those of you that attended the neurology, the cognitive fitness, think about what your brain's doing right now, how it's lighting up with all this activity.
Okay, so we do that both sides, but I'll make you do it again. The next is what we call the Michael Jackson, okay?
Oh boy.
This is angles. So what we're gonna do, your feet are gonna be a little bit apart, not totally together, okay? And we're going to very carefully lean forward from our ankles. We're not doing hips, okay? We're leaning from our ankles while keeping your feet flat on the ground. So you're just gonna lean forward and then back. Just very gently focus on your feet being firmly on the ground. Just shifting your weight.
And not your
Yeah,
core.
we're not hinging at our hips, more on our
Straight.
ankles. On your ankles. So you're leaning forward on your ankles and on your toes. All right, now we're gonna go to the side, same thing, but we're just leaning to the side. Shifting our weight to the side. Again, keeping your feet flat on the ground. All four planes of your feet. We're just really working on our ankles. Good job. Now the other side. Good. Now the last side. Very, very carefully. Okay? We are going to lean backwards.
Oh.
Your toes must stay on the ground. If you can't do it without your toes coming off, then don't lean that far back, okay?
Yes,
So it's
'cause
just
we have a hard floor.
very, very carefully leaning back. Good job. How are we feeling so far? Good. Okay. Next, we're going to do step overs. So this is like if you're stepping into your car, if you're stepping into your bathtub, stepping over your dog, whatever, you know. But you're going to, with one foot firmly planted on the ground, you're going to lift your other foot up, over, firmly planted, bring your other foot over. Make sure each foot is planted before you move your other one. Just going side to side, up and over. In the tub, out of the tub.
Oh, yeah.
In the car, out of the car. How are we all doing? Good. Now we're going to switch up and we're going to go forwards and backwards. Same premise though, okay? Foot firmly planted, lift. Once that's firmly planted, lift the other. I'm going to go backwards. Make sure you switch your feet so both feet end up going. So these are all things that you can do at home. Or you can come to my class. I have a flyer for my class. We do all these exercises plus aerobics and weights. Okay? All right. Where are we at? Nancy, where am I at? Okay. Now we're going to reach, like we're reaching across the table. You're going to take your feet out wide. And this, we are going to move from our hips, okay? We're hinging at the hips. All right, we're going to reach forward like we're reaching across the table and back up. Make sure your feet are flat on the ground. Yeah. If you hit each other, it's fine. Yep. All right. Now, if we can line, we're going to use our chairs again. So if you want to find a chair and just kind of line them up this way.
Line them up which way?
Like facing towards us.
Oh, the middle.
Yeah, facing the middle.
aisle. Are you wanting them to face the aisle?
Yeah, you can, well, just enough that we have enough room for everyone.
There you go.
So face the middle if you can. Let me grab your chair real quick.
Oh, well, I guess you do need one. Yeah, I'll take this one. Okay.
All right, we're going to do 2 more exercises. If you can, holding on to the back of your chair, we're going to do the one leg stand, right? So we're going to stand on one leg, okay? So you're going to hold on to your chair for balance, and you're going to lift one leg up, and we're going to hold it for 10 seconds. Ready? 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Good job. Don't hold your breath.
Oh, you forgot to tell us that.
I know, sorry. Don't hold your breath while we do exercises. I know, sorry.
Yeah.
All right, now we're going to switch to our other leg. Ready? Use your back of your chair if you need it. And 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Okay.
Good job. Okay. Now we're going to, Caitlin mentioned it. I think even the presentation mentioned it. It's called the sit to stand. This is...
Caitlin, are you going to come up here and be a part of this? And
She's been doing it back there.
okay.
Yeah,
Okay.
so the sit to stand is probably arguably the hardest thing that we do in class. It is a difficult thing to do for anyone, not just, seniors. It is hard. In our class, we shoot for 10. Because they say I think they said 5 to 10. I think Caitlin said 5 in her assessments. We shoot for 10. The more you can do, it's proven the better health you can be in. Okay, so that's why we do it. So what you're gonna do, you're gonna sit in your chair about halfway up.
Sit in your chair. Here,
Your feet are gonna be flat on the ground, knees at a 90-degree angle. hands across your chest because we want to be using our thighs and our booty to get up, okay? Not our hands. This is what makes it so difficult. And you're just going to stand and back down and stand. Oh, careful, careful, careful. We'll do 5. Good job.
Yeah, good job.
Yes. Yes, you can stop. Okay, how does everyone feel about those? How do you feel about those that we did? Good. Could you do those at home? Yes. Good job. Nancy's been taking my class for a little over a year. She didn't want me to point her out, but again, she did. She used to be a teacher, so she gets her payback, you know? But what did you tell me last week?
Oh, okay. We do this flexibility, and you have to put your hands, when we started, you put your hands out like this, okay? That's as far as I could go. I now can go the whole, my fingers all the way in, but when we started, I could only touch that far. So it's helped.
Yes, good. Jessica, could you tell a little more about your class and where you have it?
Yeah. Oh, well, first of all, it is free.
Oh, and we like free.
Yes, it's very economical. Not a lot on your pocketbook. It's in Pantego. We're at this fitness studio called Chica Power Fitness. They vary, you know where it is? It's by the nail place. Everyone knows where that nail place is. They very kindly let us do it there for free. It's on Tuesdays and Wednesdays. Tuesdays is at 1 o'clock. Wednesdays is at 12 o'clock. I have a flyer in the back with that information, also my information, if you wanted to just call or email me. And yeah.
Okay, I'm gonna have my nerd come out.
Oh, okay.
You will also, if you go to the class, you get a 3-day binder
Oh, yes.
with all of the exercises shown out with a sticky figure. Stick figure.
Yes.
Stick figure. But this program was designed by the Washington State University, and it's a nationally known program to help those young ones of us to keep in good shape, keep flexible, have stability, and hopefully never fall.
We also, we drop some fall education in there sometimes. We talk about, some things that y'all are going through. And we also do assessments. So about every 3 to 6 months, depending on when I remember to do them, we do 3 tests. It's the sit to stand. It's the 8-foot up and go, which Caitlin also talked about. And then a bicep curl with weights. So we do that and then you can track your progress to see how you're doing. Everyone that started, that's continuing, like Debbie's parents, are all improving. So we like to see.
How long is the class?
It's depending on how fast I talk. Anywhere from 30 to 45 minutes. Yeah.
Pantego?
Pantego.
I know where that is.
The Tom
Park Row and Bowen.
I know where that is. And Schlotsky.
And the Schlotsky.
Yes. Okay. Yeah.
Next to the Queens, the Schlotsky.
So that's Park Row and Bowen.
Yes.
Yes.
Yeah.
Southwest Coast.
Yeah.
Right.
Yeah.
Okay. Are we good on our exercises?
Yes.
Caitlin, do you have anything that you want to add that we missed?
No, I think it's great. I'm gonna send some patients to her.
Please.
I do have handouts of exercises too, so if you would like one, they have pretty much everything that we did a little bit and then plus some more.
I also have a sign-up list if you want. I don't know if this is the right time. Sorry.
No, we're not ready for that just yet.
Oh, okay.
Let's do finish our presentation
yep.
first. Okay. So let me just see this. Did you all feel that was beneficial?
Yeah.
And you feel like that's something that, oh, I could do that, like she mentioned. I could do that at home and feel like I'm achieving some things. What was the hardest thing for you to do?
The one leg.
The one leg?
The one leg. The heel toe. Yeah.
I think for me it was that. It was the sobriety walk.
The sobriety walk.
Yeah, that was a little bit tough. Anybody else? Heel toe, one leg, what else? No, that's it? So obviously I know which one I need to practice on. Okay, all right. Well then let's look at some action steps. So we want to talk about this, what comes after this exercise that we did today. This is a little bit different seminar than we've done in the past because we wanted to give you something to walk away with. We always hope you have something to walk away with. But in this particular case, our action steps would be implement the exercises that you've learned today. So how will you implement those? Join a class, right? That would be a good way to do that. Even if you just want to go and try it out and get started and see if that's good for you. That would be one way to do that. Consider a fitness class or a workshop. So here again, we were talking about, for us, I want to do the muscle memories. I just don't know when I can make that work, but yeah, I want to do that. I'm already doing some things. So be purposed about taking that on. So we're in August now. So we've got August, September, October, November, December, 5 months. What could we achieve if we made changes in 5 months?
So many things. But I will say the tip is, I always tell my patients to incorporate it throughout your day. So if you're standing at the counter brushing your teeth, stand on one leg. Or put one foot in front of the other and do that. Practice walking down the hall a few times with sobriety test. It doesn't have to be set time or away from your schedule. You could do a little bit every day.
Yes, or if you're at the grocery store and you're not having to sack your groceries yourself, you could be practicing picking your leg up, or doing this. And they're going to get your attention. They're probably going to get you to the front of the line. Okay, so review medications for side effects. So that was important because for beta blockers, we were talking about that today, and that may be something that you weren't aware of. Oh, I should exercise, but there's some things I need to do in moderation, or maybe not at all. So that's going to be really important. Get regular medical and vision checkups. So I think, there's certain benchmarks that we have to do that, but I think what's important for me would be the vision. Always making sure that you can see well so that you're not going to be missing something when you're trying to step over that dog, right? I think that's important. So the checkups, always make sure that you're on top of that, as well as the hearing tests. I think those are important. Ask your doctor about adding calcium and vitamin D to lower your fracture risk. So 4 years ago, I was diagnosed with osteopenia. And I thought, oh my goodness, what does that mean for me? You're doing a bone density on a regular basis. Well, I will tell you that now I take 5,000 units of vitamin D, and I take calcium, magnesium, and for me personally, I have trouble sleeping at night, but since I have gone to calcium, magnesium, I take 1,200 units a day. But I'll tell you what, that magnesium, that's my sleeping pill. It works great for that, but it's also helping keeping my bones in good shape. And since I became aware of osteopenia, and I've gotten myself on this regime, the last few bone densities that I've had, they've said no change. So that was encouraging to keep that up. So I would tell you to check into that and see where you are. The other thing that I found out is, a few years ago, I think it was 2020, we had this thing that happened to all of us. That fun thing that we couldn't be with anybody. Well, I'll tell you, taking vitamin D and zinc is also good for that. So keep that in mind. And then last but not least, remove trip and fall risk things in your home. So what could that be? Give me some ideas. What could be something that you could trip over in your house?
Dog.
Dog.
Well, dog, yeah. I don't know, that'd be a tough one.
Loose rugs.
Loose rugs. all those cool rugs that we like to have laying out, if they aren't rubberized on the bottom and they don't move, it's probably a good time to get rid of it. What else could we remove?
Lighting. You have to adjust your lighting.
If you have to adjust your lighting. I will tell you this, as a real estate agent, oftentimes when I go to visit, or John and I go to visit somebody, a lot of times as time goes on, we like to get all of our stuff close together so that when people come over, we can also be really close together, or we're closer to the TV or whatever the case may be. When you go home today, take a look to see what have you done furniture-wise in your house to change things to make it more convenient for you. But if somebody else came in, would they have to come in this way to get to it? Or is that you or a family member? Or maybe that would be something that would cause somebody to trip because it's the ottoman, or it's the table, the cord, the light cord, because it didn't reach all the way, so it's in here and it's easy to trip over. John and I just listed a house a few months ago. It's sold now, but in Fort Worth, beautiful home. Lighting was an important thing for them, but when I went to visit them the first time, while the lamp was in between two recliners, the cord went all the way over here to the wall. And so I suggested to my homeowner, I said, that's kind of a risky thing for us to do during showings, because you're going to have somebody coming in here, looking at your house, identifying it, what would it be like for them? Number one, they may see that the outlets are so far away, or number two, not paying attention is they're looking at all the beautiful things, they're coming in here and tripping over that cord and maybe even breaking the lamp. So check to see how you have things set up for what you think are convenient, but are they safe for you? I think that's something to keep in mind. Anything else that you would think about, maybe not removing so much, but repositioning in your home to keep you safe?
I'm sorry. Medications. If your medications are in a warm spot, they may, or if they're in a spot where humidity comes in, they need to be shifted to somewhere where it's dry.
Yes.
Preferably somewhere where you can reach it.
Good point. And the reaching thing. So that's another thing. I don't know about you, but for me, I will say that when I first came to Texas, I was 5'6", and now I'm 5'4". I'm shrinking. For some people, and I've got a couple people right now that have said this to me, they don't use their microwave much anymore. Why is that? Too high. So sometimes what that makes sense when I'm seeing a microwave on a counter, because it's easier to get to. Think of some of those things. Just keep those things in mind. What's going on around you, and how can you retrofit those to make them work better for you? So what questions do you have for our experts before we go to our drawings today that maybe we haven't covered yet?
I've got one. What's the
Yes.
difference between osteopenia and osteoporosis?
Well, I think osteopenia is onset to osteoporosis.
Okay.
That's my understanding.
Okay.
Am I right?
Yes, diagnostically, it just means your bone density is not quite to the critical level of osteoporosis.
And it's important to pay attention to your surroundings and your gait and everything else, because your bones are weaker. Yeah. Who else? Question?
I have another one.
Yes.
At home, to strengthen, what can we use at home that we don't have to go out and buy?
Soup,
Yeah.
soup cans, water bottles,
Those gallon jugs, half-gallon jugs.
yeah, you got jugs, anything that has some weight to it. You don't want to hurt yourself, obviously, so nothing too large. But anything that you can hold in your hands that you can.
Okay.
Well, also, can they use, like if they have a bungee cord?
Right, belts.
Yeah.
Use belts.
Or to,
Yeah, if you had Bungee cords because they have the hook on them. You don't want to use those in case you slap
Like
in your
you're
face.
gonna
Yeah.
And also, if I may, I'm no expert here, but I'm just an expert here. When you are at home, you can,
Yes.
anything that you can fit under, you can push against, you can do this, and it'll keep you, you can keep yourself straight. Because when you're at a 90-degree angle, it kind of helps.
Well, I just thought about something else. There's a few men here today. How many of you still have ties? Maybe you don't wear ties. I know we all need one, but you know, that might be a way to tie some of those ties together, and you can use those to stretch with. Put them around the bottom, because I know that the reason I say that is that my husband had a total knee replacement a few months ago. So all the exercises that he's doing now for the knee to make sure that it's flexible and pliable, he now has something that they've given him, but prior to that, just using something that could cause you to stretch. So there may be things that you have in your home. Anything else? Okay, last question, and we're going to do our drawing. Oh, Debbie, did you have something?
Can't remember, Joanna, where are you? Did you
She's right
read
here.
this about the contacting your congressman? I can't remember.
Yeah, speak up so
I
we
can't
can hear.
remember. Anyway, one of our attendees gave me this flyer that I put in your handout. Right now, fall risk assessments are not covered by Medicare, but there's a bill in Congress that they're trying to get passed to have those covered as part of Medicare. So this flyer has a QR code and also a website. You could go and it'll direct you to who you need to contact and the verbiage that you can put in the letter and everything. So if you're interested in checking that out, I've got that for you.
Yeah, that's great. Joanna brought that. Thank you for doing that. You're so helpful. You always have a little idea on something
She
you
sent it with
can
her, but somebody at one of our seminars.
do. Okay, okay.
Now, what does the bill say? I mean, I'm a little confused about.
They're just trying to get Medicare to include fall risk assessments as a covered well check.
Oh,
as
it's part of your
wellness,
wellness check?
yeah.
Physical, once a month, I'll be once a year?
Once a year, yeah.
Annual.
And there's more on it here, and then if you go to this website, it has more information as well.
Okay,